Excellent. And going from the East Coast to the West Coast, this is a great day indeed to have Michelle followed up by Sarah. And again, had spoken a little bit about Sarah's background earlier in recapping what was coming up in the 3 p.m. hour here. But again, just one of the folks who is eating, living, sleeping, and thinking digital health all the time. EVP, Chief Strategy and Digital Officer at Providence Health Systems, the biggest private health system in the country and across, I think, Sarah, correct me if I'm wrong, 13 states on the West Coast or something like that. It's a massive health system, 7 states on the West Coast. And how many patients do you guys cover?
We serve about over 5 million patients a year.
Yeah, so 5 million patients, 7 states, and just a massive enterprise with a lot going on with digital, obviously, given everything that's happening in the world over the last few years and certainly today. But to start us off, Sarah, if you could give us a 1 or 2 minute sketch on your personal journey. How did you get to Providence and really just such an impressive career as EVP and Chief Strategy and Digital Officer at Providence? Talk to a little bit about that role too.
Sure. I'd love to give sort of the overview of what we're doing. And I'm super excited to be here. And especially, even though Michelle is an extremely difficult act to follow, her content was just so fascinating and so aligned with a lot of the principles and things that we're trying to do at Providence. So I just love that. That was absolutely it was really thrilling to see what she's done so far. So I've been at Providence for just under 7 years. It'll be 7 years in January. And up until recently, I sat exclusively within the digital team. And digital is a bit of it's not a complete title in that it's actually really the consumer-facing front end of the organization. So everything from discovery of how a patient goes through the process of figuring out what they need, what their issue is, what they need, how they actually convert into becoming a patient, and then how we cultivate that journey and become a partner with them and then engage with them on an ongoing basis. So for us, the different teams within that domain are marketing, so really focused on consumer and patient acquisition, and that's really about surfacing up what we're doing so that folks can know what is available to them. We have a digital experience team that is focused on everything across our different digital channels, both our owned properties like our website and our mobile application, as well as partners. So we work with marketplaces like ZocDoc, we work with payers, we work with Google very closely in order to really be in all the places where folks are searching for care and are engaging with health-related content and tools. And then finally, we actually have a product incubator, and that product incubator builds software in sort of areas of opportunity where there's an unmet need in the market, and we build it for that kind of consumer-facing front end to drive access, convenience, ongoing engagement with the folks that we have within our ecosystem and even beyond. So all of our digital tools, you don't have to be a patient to necessarily use them. You can just be a consumer that's out in the wild, so to speak. And we provide these services across our 7-state footprint that cares for over 5 million folks. We have 1,000, or actually over 1,000 ambulatory sites across the footprint of Providence. We're vertically integrated, so we have a health plan. We do a lot of work in the post-acute space. So we think about it very holistically. And then even to branch out further, it's not just in the context of a patient, but again, in the context of a consumer. So folks who may not have a clinical account with us, but need other products and services from us. So that's what I do within the digital domain. And I came to Providence, 7 years ago. And prior to that, I was a management consultant, and I'm always in the health in the provider space. And before that, I worked at the intersection of health services research and health policy. So I worked with a lot of state agencies in the earlier days of patient-centered medical homes and the HIPAA high-tech work that used to be done back in the mid-2000s. And did a lot of work with, our healthcare authority, the Office of the Insurance Commissioner, the Office of Financial Management, around big kind of state policy projects. And then before that, I was a scientist, actually. So I started my career as at a medical device company doing kind of translational research around therapeutic ultrasound.
That's brilliant. And so if you could tell us a little bit about what you and your team are doing. It sounds like you have a lot under your umbrella, but what are like one or two of the bigger projects and programs you're working on these days?
Yeah, sure. And, one of the reasons why Michelle's presentation was so interesting to me is that it actually was very aligned with something that we're doing around what we call identity-driven engagement. And if you fundamentally kind of think about what digital innovation has done in other industries, digital transformation is fundamentally about how you leveraging technology generate, aggregate, and capture demand in a completely different way. And in the case of a health system, our demand is the patients and the folks out in the wild, the consumers that are potentially looking for care. And one of the main, we do that as a driver of growth for our system. We need to keep extending our reach and extending into our communities in terms of how many folks we care for and bringing them into our ecosystem. And so again, there's sort of customer acquisition, engagement, and then engaging with folks from like not just a transactional kind of perspective, but on an ongoing basis. So you've probably heard the term like wallet share, those kinds of things, to be kind of crude about it. It's not just about wallet share, of course, it's about really being there and supporting folks across their entire journey. So identity-driven engagement supports all of those things. In any other industry, the way that you achieve engagement is primarily through personalization. And what I loved about what Michelle showed is that they created this really simple web-based way of engaging with folks who may traditionally not have been engaged. And a lot of that is about, making it frictionless and connecting it to an individual and their identity. And and what that means is that, like Stan, when you go onto your Amazon site, you log in, right? You have an authenticated experience that's connected to you. And then that informs the way that the products show up on your homepage. And it's personalized to you, it's relevant, and you're more likely as a result to keep returning. They have a concept of a daily habit. And now healthcare is very different. We're not just trying to sell random products to people, and we don't expect a daily habit in many cases. But it is really important to engage folks through by knowing them, by delivering relevant products and services, and then connecting them too. So it's not just about providence. It's actually, we have kind of this, view of the world, which is that care is decentralized, and so it gets delivered in all sorts of different places, and it will continue to be that way. And so we're not trying to entrap folks into our environment only. We're trying to make the ecosystem of care and other products and services available to them. So it's really about bringing in, connectivity to the ecosystem, and then really understanding how folks are engaging and interacting, I should say, with these different pieces. So that's what we're working on now, and I just find it to be one of the most exciting times in digital health, because it's going to allow us to actually respond to individual needs, not personas or sort of generic patient stories or things like that, but like actual N of one personalization. Stan's experience is Stan's experience, Sarah's experience is Sarah's experience. And, every single person has a different one because of what we know about you.
That's incredible. Well, what a great story, and just an amazing amount of digital that you're bringing into the Providence experience, and ensuring that the patient's experience is going to be one that is holistic. So obviously, trying to use digital as a lever to make their journey through everything that's going on at Providence more efficient, more effective, and definitely lead to much better outcomes. And when you look at 2023, there's, and by the way, we can go a little bit late past 4 if you like. I don't know what your time is like. We want to respect your time if you have to jump. But if you look at 2023, you clearly have a lot going on in your department. But what are the things that you're most excited about in 2023 that you're tackling?
So the platform that we're building around 2020 currently is something that we're going to create a new company around in 2023 and spin it out of Providence and make it available to the broader market. So we have an innovation and company creation model that we have sort of turned the crank on 3 times in the past. The last time was a company in 2021 that we spun out of Providence called DexCare, and they are an access optimization platform as a service. And they help sort of drive discovery, navigation to the right venue and modality of care, and then supply demand matching. And so we're taking, it's like a similar theme. You can kind of hear a lot of the same themes around the things that we build. And we're going to launch another company around this exact concept of identity-driven engagement next year. So we're really focused on that. That model allows us to sort of take these solutions that we build with our unique vantage point of like having access to a sandbox that is within a delivery environment, people, operational expertise, and a really strong network, and then take that to market. So that's what, in addition to just like all the product development work and serving our own organization, that's what we're going to be focused on in 2023. And that's just really exciting. The other thing I'll say about it, which is something that I think digital health and digital in healthcare, I shouldn't say digital health only, because it's sort of, I think, a part of the overall picture of how digital can tech enable healthcare more generally. But there's been, especially in the last year, as the economic environment has really become more challenging and providers in particular are really struggling financially, the notion of like, well, what do we have to show for all of the work that's actually been done in digital, right? Like, the billions of dollars of healthcare IT and digital health investment from the venture community, the thousands and thousands of companies that have been created, the millions and millions of dollars that providers have spent in order to tech enable their systems. Well, what do we have to show for it? And I'm super excited that what we're actually doing is we've built a platform that we can take product metrics and connect them to business outcomes. And we're doing it at scale across our whole system. So being able to demonstrate that, I think, is going to be really powerful for making the case for continuing to do digital and drive digital adoption. So that's another thing that I'm really, really thrilled about. And I'm thrilled that the industry in general is sort of moving in that direction.
That's great. And, I think that spells out nothing but good things for the Providence patients. So that's really good to see. And, obviously we have a ton of questions, as you can imagine, and the stuff that you guys are doing is so impactful and so relevant today to the ecosystem that it's not a surprise that there are a number of folks that want to learn more about what you're doing and how you're doing it and that sort of thing. And so, I think one question that's coming in through my LinkedIn page is about the digital front door. A lot of hospital systems have adopted digital front doors for patients. They've been met with varying degrees of usage and follow-up. And so talk to us a little bit about the digital front door. It seemed like in 2020, that was all the rage, kind of like decentralized clinical trials, kind of like virtual care. And we'll talk about that in a minute. There's another question there. But yeah, again, for right now, Jen wants to know about digital front door and if that's how that's going at Providence these days.
We don't use the word digital front door for a number of reasons. So digital front door is there's no such thing. There are so many different doors through which a user can access Providence or any of our services. And again, it's not just about Providence, really. It's about giving folks access to a system of care that could be Providence, could be others, and needs to be trusted and personalized toward them. So we have many digital front doors. You can access a lot of our services through Google. You can access it through marketplaces. You can access it through payers, as well as through our own assets. And so that's one thing, right? Forget about the digital front door. There are an effectively, infinite number of front doors that with the power of the internet that users can engage with. And then the question is a fair one though, like, why do they suffer from adoption, from like lack of adoption? And there are a lot of reasons, but I would say a couple. One is, again, it's generally not a good idea to limit the choice and try to entrap users into one system, right? That's not how folks engage anymore. And so if marketplaces are very powerful when it comes to how services are rendered to individuals. The second is they lack personalization because they don't know you. And if you don't have the ability to really feel like your specific needs are being met, you'll lose interest over time. And then I would say the last one that I'll cover today is just the lack of actual ability to get your specific needs met, like task completion. Can I book an appointment, for instance? Can I get the relevant piece of information that I need about my medication or whatever the case may be, right? And then get a prescription refill. So if it doesn't have utility and you can't complete the task, again, you're going to lose interest. And so those are some big themes, but there are a number of others as well.
Yeah, no, please. And I think one of those telemedicine. We've been talking about that through the summit. It's one of the big themes about, telemedicine was one of those, the tree was bent over. We saw a massive amount of run to telemedicine just for the sake of being able to do anything for patients remotely that didn't have COVID and didn't have that kind of infection. And so telemedicine became front and center for everybody. Is that now coming back to midpoint where pre-COVID, it was sitting in the kind of like the low single digits, the high single digits, the low double digits, or is that still in the 30 to 50% range that some people saw during the height of the pandemic?
So it depends. First I would say we've segmented out the concept of telemedicine into really the different types of use cases around which an individual would need virtual care or telemedicine. There's sort of the I need care now, provider agnostic, more on-demand type stuff. There is ongoing sort of relationship with your provider that you might, have a chronic disease visit that instead of going in person, you do it virtually. And so we've separated those things. But as a general theme, we spiked at about 60 to 70% of our total volumes being done virtually at, big heights of the pandemic during the Alpha, the Delta waves in particular, surges. And then over time that has dissipated significantly. Before the pandemic, we had less than 1% of our visits being conducted virtually. And now we're in the single digits again, I would say single to low double digits. And part of that is because it's not sufficient to just provide the alternative modality, but then take this sort of substitutive approach, right? Just swap out a physical visit for a virtual visit. It requires, the term like hybridization or whatever you want to call it. We really just think about it as like a system of care that's multimodal, and it requires significant operational change, experience changes, et cetera. And we haven't fully realized that. So we're still on our journey. And some of that, it's just difficult to do at this point because we have a really significant workforce crisis going on in the country. Our providers are already burned out, adding more, and asking them to do care transformation while they're just barely keeping their head above water. All of those are very difficult. So we're being very thoughtful about approaching that problem.
That's amazing. And so when we now talk about remote patient monitoring. Actually, there's a quick question in the chat room. Julia wants to know more about data transfer and how Providence transfers data, like images, particularly around the system, and how that's done. Is that something? I'm assuming, Julia, if you want clarify a little bit, either in the chat or in the Q&A box. I'm assuming she's talking about radiological images. And how is that transferred over? We saw Harvard, for instance, the entire system crashed. John Halomka published a massive paper, did a huge presentation at HIMSS about 10 years ago because one server, one doctor tried to upload like a 90 gigabyte file. It crashed one server in one hospital. And the way the servers were architected, it destroyed the entire server infrastructure. Harvard was down for 3 days. No electronic health record. They were running 24-hour batches of FedEx Kinko's printed EHR papers to keep track of the patients. And so, but obviously, with modern server infrastructure in the cloud, those issues are gone. But the idea here is with what you're doing with image transfer, how is that being conducted, and what have your experiences been with that?
It's a great question, and I can say confidently I don't know the good answer to it, mainly because that type of work is primarily done through our IS division and our CIO. So they own a lot of our core infrastructure, a lot of the platforms, all of our Azure, everything that we do cloud, our cloud instances, everything that we do from a core application perspective, it's owned by them, including our EMR. And so as well as how we partner with affiliates around data transfer and things like that. So so it's a great question, and I'm happy to follow up.
That's great. No, thank you for that. And we can certainly send that out to Julia via email and keep her apprised of the answer on that one. And then let's just double check. We'll keep going through. And are you going to be at JP Morgan Healthcare? A lot of folks on the program today are going to be at JP Morgan in San Francisco, January 9th through 11th. Is that something you're attending?
Yeah, it is interesting. I find a lot of these conferences are really useful for the meetings around them. So I'll be there, I'll be meeting with folks. I don't attend the sessions, but I go and meet with folks. We're really, given that we're focused on our NewCo launch and a lot of the other sort of industry focused stuff rather than Providence internally focused, we'll be there.
Oh, great. Okay, good. So anyway, so talk about the NewCo launch for 1 second. What does that include and what does that mean?
So the platform that we're building around identity-driven engagement, we are going to hire a CEO for it. We're working on a pipeline of 20 other health systems that that we're kind of working on for a commercial arrangement. And then in support of the CEO of the company, when we bring that person on, we will support them in raising funds, transferring IP, doing all that. And then we will have another company that becomes part of the Providence portfolio, but it will be an independent company. So we don't maintain a controlling interest in any of the companies that we spin out on from my team as a going concern of the organization.
That's fantastic. Yeah, I think that is important for the audience to understand too, right? That there is this arm at Providence, and again, I've met him. He's a very pleasant gentleman called Providence Ventures. And so maybe talk a little bit about what they do and how you interact with them as a way to really help grow innovation, because obviously capital is the lifeblood of innovation. So maybe you could talk a little bit about that group and that interaction that you have with them.
Sure. Yeah, so Providence Ventures is a group of professional investors. It's our corporate venture capital fund, so an internal captive fund that makes investments in healthcare IT, tech-enabled services, digital health companies, and they're on their second fund, currently deploying capital across their second fund. And I work with them really closely in terms of understanding the market, understanding what unmet needs there are out there. They see thousands of companies every year, and so we partner really closely with them to understand the market. That since they're really the outside-in innovation arm of the organization, and then when we partner with them to understand the market, and then when we're launching a new company, the technology as well as the companies that are created eventually become part of the Providence Ventures portfolio. So we've got a very rigorous model for getting external validation rather than relying on our own sort of internal echo chamber. So we bring a CEO in from the outside. That's an external validation point that shows like a talented, proven entrepreneur is willing to work with us. We get external customers, so we know someone else is willing to pay for it. And then we go and we raise capital Providence Ventures does lead rounds all the time, but they do not lead the rounds that we go and incubate and ourselves, because again, we need another, we want to make sure someone else is willing to write us a check. So they'll kind of ride alongside us in that process, support us, and then the company will become part of their portfolio once it gets spun out.
That's brilliant. Absolutely brilliant. Good for you guys. Really good to see that too. It's such an important element of being able to initiate and then oversee and see through innovation at the biggest levels, is to have those funding sources there to help support that. So this has been great, and just again, phenomenal presentation, and just hoping you have a great new year. You guys work absolutely terrific hours, and I think you do terrific things, obviously, and looking forward to catching up with you all at JP Morgan. Have a great holiday. Have a great new year, Sarah. Take care.
Thank you. Thanks for having me.